off the recording after the presentation, right before we go into dialogue. But the recording does help to be able to share information with everyone who is in attendance today. And also the recording will be posted, eventually be posted on the ARC of Massachusetts YouTube channel. We want to make sure that everyone understands the information we are providing today. So if clarification is needed on any agenda topic, we will acknowledge questions relating to that specific agenda topic once the speaker is finished presenting the information. We also ask to reduce distractions and background noises. If you would please keep your mic on mute during the presentation. All right, and we're going to get right into, I'm going to give a quick overview of MA 21. Leo, if you could go to that next slide, please. Thank you. So the Massachusetts Alliance for 21st Century Disability Policy was formed in 2007. The Alliance has done incredible work over the past 17 plus years, protecting the right of people with disabilities to self-direct. Through these efforts, the Real Lives Law was passed in 2014. The MA 21 is a partnership of many persons with disabilities, family members, other stakeholders, and disability advocacy organizations, including those listed here on the slide. Next slide, Leo. I'm going to go ahead and put the, I'll put the link in the chat, but this is the definition of the self-direction service model as DDS defines it. It's definitely, you want to visit the website, you want to take advantage of just learning everything that you can regarding the service model. And next slide. We ask that you utilize the MA 21 website. It is like incredible amount of information, very, very helpful. This is where you can register for future meetings. Once you register for a meeting, you can actually, once you click on to register for future meetings, you can actually register for all our upcoming meetings. You have the opportunity to subscribe to our communications. We'll be communicating more often in between our large group meetings. So if you want to stay updated, you definitely want to go ahead and sign up to receive those communications. And that's the Join Our Efforts link. And there is a lot of information in the document library. Again, once you get on to the website, just go ahead and navigate through and you'll learn more about the information and resources that, that we have on the website.
I would just add on the library and other resources, but the library can be accessed when you're on the home page of the MA 21 Alliance. You have to scroll down to the second page, and I just would say that Ed Underwood has done a terrific job of number one, kind of organizing it to give you updates on kind of the newest updates on what's on the library, so you can just look at it if you've already perused it. And so please use the library, or at least get familiar with the library. Thank you.
Okay, Leo, this is where you can take over.
Yep, sure. Thank you, Diane. And everyone will get the slides. Katerina will make sure they go out. So I just sent them to her. So I'm assuming we're not going to change them at this point. So, all right. So So just a couple of slides for me. Just one is changes in leadership at the Department of Developmental Services. Many of you have already heard about this. Jane Ryder retired at the end of August. We wish her the best on her new chapter in her journey and appreciate the assistance, the second set of regulations and other work, the work now going on for independent facilitator that's in process. And the DDS Acting Commissioner, Sarah Peterson, she was and still is probably the chief legal counsel for the department. It appears, to be somebody who wants to work with people. So, we look forward to working with her because there's still a lot to be done, right? And not only in self-direction, but in other areas. And then a search, it could take several months for a new commissioner, depending upon what kind of process they go through. And once they choose someone, they have to announce, they have to resign from wherever they are, unless they haven't. So that's just be ready for that. And the department also lost a deputy commissioner at the same time that had given her notice. I don't have the details of that. I know it had to do with her own decision, as in both cases. So, that left a gap there, as you can imagine. The other thing I want to talk about is the change in self-direction. And I know there's a chat there, so Diane, you'll let me know if it's relevant for what just happened. But DDS changed the fiscal intermediary of the FMS, Fiscal Management Service, depending on which initials you want to use, what jargon. And it's now Acumen, and that was done through a competitive bidding process. A couple of facts about the change. They have a client services agent model. And let me explain what I know about that. Just translates into a call center 24/7 for those of you that use the PDP or the Participant Directed Program. And they also they plan to have 7 local agents. Acumen is in 30 states, and that might include us. So maybe they were in 29. And January 1st will be the start of it. Until, as you know, I'm spacing out on the name. It's something public partnerships is the present FI. And it will also be doing it for the Autism Waiver Program and the DDS program. So, because they're all self-direction programs, the Autism Waiver Program is for kids. Just as a reminder, it's we call it the kids one. I guess children would be more appropriate. And DDS is children at a certain age and teens, obviously, till 22. And if you have questions, the department has suggested that people call the PDP broker for any questions. And you might want to call your local, right? Every area office has a local self-direction person as well as a regional one. So that might be another strategy as well. Just let me close with this and hand over the ball to Robert in a second. And FY15, fiscal year 2015, there were 840 participants in self-direction services. Today, there are 2,430 participants, along with a budget that has tripled. So just want to share that with you as well. Let me go ahead and hand over the ball to Robert.
Let's find out, Diane, are there any hands or are there any questions that have been raised on the last 2 topics?
No.
Okay. So you could go back one more back to that slide. I had a comment. I just would say that again, this is at the Self-Determination Advisory Board meeting of September 4th, which they have the advisory board meetings for those who want to go virtually is very difficult because of the setup they have. They're as far as I know, their virtual computer video did not work, and I can't believe that the phone worked. But they still are very important meetings. This time I decided to go personally because that way I could hear and see what was going on. And they did announce this at that meeting. So they're important meetings, and going to get more important to know what fundamentally is happening with the self-direction. Those meetings are every 3 months. So the next meeting is December. That's the Self-Determination Advisory Board. And the other thing I would say is it says effective January 1st. That is their goal of 2025. But I think they were clearly stated that is their goal, and they have everybody's got incentives to get it done, because that's Acumen wants to get on and get with it. But you know, whether or not they meet that goal, they've got a lot of work to do. Okay. Okay, well, of course, we've all been quite involved, or most of us on this call have been quite involved with the regulatory process. Again, as a brief background on it, the Real-Life Law was enacted in 2014, and it required the department to issue enabling regulations, both in very specific areas such as qualifications of independent facilitators, absolute requirement, and then a general requirement to issue regulations. And the regulations have not been adopted to date. So we're now, 10 years into it. The first time that DDS tried to initiate regulations was in October of 2022. The community was mobilized, and the hearing was held in November. 100 people appeared at the hearing, and 20 plus people spoke, and 20 plus people did written testimony, and those regulations were withdrawn. Then May of 2024, about a year and a half later, new revised regs came out, and we mobilized again, and June 18th, there was the hearing. And, you know, I think we're not going to get into the weeds on what the proposed regulations said, but again, in the MA 21 library, you'll find that there were now over 40 written comments. Comments are tremendous, written testimony, tremendous. There were more than 20 people that gave verbal comments, and those are on the MA 21 website as well. So, you know, you would get a good flavor of that. The regulations are now in a review process by the government. Not clear to me exactly where that is, but there is a review process. And there are, since June 18th, there have been efforts by, at somewhat of the urging of MA 21, but certainly also independent of MA 21, efforts to communicate with EOHHS as to the proposed regulations, where they may be better than the October 2022, but primarily where they fall short. And the Disability Law Center met with EOHHS, the Executive Office of Health and Human Services, met with the officials there and expressed their concern. And Leo, on behalf of the ARC of Mass, has met with EOHHS and covered his regulatory concerns, both verbally and in writing. So at this point, MA 21 is looking for advocacy to outside of MA 21, particularly with our member organizations, to do what they can if there's a potential for improving the regs. So just from a process standpoint, the department can modify the proposed regulations based on the comments, and then they can simply issue them. They don't have to go through another hearing process. So, you know, from MA 21 standpoint, we feel we've done sufficient ourselves at MA 21, and we're moving ahead based on the fact that there will be regulations, and they'll be somewhere in the ballpark of what the proposed regulations on June 18th. Of course, we hope to be better. We hope the department modifies them, but we're moving ahead. And in addition to MA 21 member organizations, there are other groups of individuals that are trying to impact at the executive office level on the proposed regulations, so and other matters. Leo, did you want to add anything to your view of communications with the executive office of health and
Sure,
human
I mean,
services.
yeah, I mean, look, it's supposedly they're reviewing it now in the administration finance, right? The regulations. When we had last talked to HHS about them, they had received the full packet, and that was probably a good month after the meeting, I remember, after the testimony. So it does take time. I think they've been very careful. There's also another like group of families that have been meeting, you know, with the Secretariat as well. But it's basically, you can imagine with the transition of the commissioner, you know, I worry about delay. And one of the things we've talked about, and Robert especially has talked about, is not letting that slow us down too much, because people are struggling with the implementation of their own plans. I do want to add something about your point earlier, Robert, about the law. One of the things in our discussions that has come up, and it's been really healthy, because sometimes for me, these other laws or these other regulations that DDS has, it becomes like an elephant in the living room, if you know what I mean. I've been used to it so long, but we've been discussing it, and there's other requirements like the community plan that was introduced, that requires really person-centered planning for everybody. And we haven't gotten to it yet, but Robert, you brought up the waivers a lot, and what the state says it will do in those waivers. So we have some other pathways. So I want to add that point. So not only are these regs, if we're not successful in getting everything, you know, that we want, that families and individuals with disabilities need, right? We should move forward with the other route, you know, with the existing statements, right? So let me leave it there.
Okay, so I think that's a good point, and one of the reasons the link is there on this page is, you know, the real lives law is, and I speak to myself about this. I mean, I'm kind of talking to myself as well as the audience. The real lives law is really quite a readable statute, you know, as opposed to a lot of statutes that are not very readable. And so I would just encourage people to, you know, every couple of weeks, read it again, because it's quite an interesting document. And if you read it, and you can read it in parts or whatever, however you read. But a good example of that is, you know, person-centered planning is part of the process, and it must be mentioned, you know, 5, 10 times. And although it's not really defined well, it goes to Leo's point, is that it's required to be person-centered planning within the individual support plan. So it's another lever to make sure that in reality, the individual support plans are developed under person-centered planning principles. And that's extremely important, particularly if when we get into the needs assessment we're going to talk about that's going on and so on, because this should be based on this person being the center of the who has impairments being the center of the planning, and that person being able to participate and be heard. Okay. So this is just, again, you know, how we're going to, I think, how MA 21 is going to behave. These are our principles, and you know, when it says enabling regulations are critical, yeah, they're very critical, and the enabling regulations that we're likely to see are not going to get us where we want to go on 1, 2, 3, and 4, particularly too far. But I would say, for instance, that on number 1, the proposed regulations in 2024 are far superior, because the previous regulations would seem to have severely restricted the individual. On the other hand, you know, this is how it happens in government. They emphasize then, well, if individuals, the right of individuals for DDS, all individuals eligible for DDS services, but you know, we're going to look at whether you've got DAHAB, and we're going to count that against you, or whatever it is. So those are just variations. And if you go to the comments, you'll see that there was quite a bit of discussion on that, trying to look at other resources and reduce self-directed services, and why that's not correct. Not why that's not correct. It doesn't apply to the traditional system, and it shouldn't apply to self-direction. But anyway, the proposed regs were much better in removing restrictions on who could be in the system, be in self-direction. On transparent funding allocations, the regulations were better in the sense that the department finally, after 10 years, acknowledged that the law said that the funding allocation for self-directed services would be based on current need and would be based on the equivalence to the cost of traditional services. So finally, they acknowledged that, and they said, yes, it shall be equivalent to, not exceed, but shall be equivalent to the cost of traditional services. If you contrast that with the October 2022, they said the department may consider the cost of traditional services, which means nothing. So, it's taken 10 years for them to issue regulations that recite what the law says, because the law just says it shall be equivalent. A reason that that's important, and I just want to read from the Arc of Masses summer 2024 Advocate newsletter, and boy, if people don't read this thing, this is one of the great magazines about what's going on in the world of developmental disabilities, in my opinion. I'm a board member, though I have to tell you that, of the Arc of Mass, but I still think it's I'm partly a board member because I think they put out a great newsletter. But one of the things that happened in the budget that was passed in July, I think, was there's been an historic increase in human service workforce rates, with Governor Healy's $485 million investment in Chapter 257, which will ensure the median benchmark for direct care salaries will be no less than $20 an hour. So the way the system is supposed to work is that you have anybody in self-direction has a current needs assessment and that results in levels of services, and then their funding allocation is to be based on, well, what would be the cost of those services in a traditional model. So you would then, as they incorporate these Chapter 257 rate increases for direct care support staff, that would be incorporated into adjusting people's budget. In fact, the Chapter 257, which is the rate structure for traditional services, this Chapter 257 rates have been substantially increased over the last 4 or 5 years, substantially, 30, 40%. But there is no mechanism, no methodology, no way in which those adjustments find themselves into the self-direction funding allocation on an annual basis. There's no method to do that because there's no methodology for determining what the cost of traditional services would be, adjusted by what's been the increase over the last year or two. So that's just an example of that's coming forward, but that's a big increase in the direct support, and most self-direction budgets have and most traditional service budgets have direct support rates. Number 3, very little progress in that matter. The department appears to be absolutely committed to the fact that this is going to be only an employer-employee program, and they're going to limit the purchases of services, even though the real lives law absolutely, you read it and it's support services, supports and services, and it's for the individual to tailor their own supports and services. But we're not making a lot of progress on that. We're just going to have to keep on pushing. And then independent facilitators, this is where there is some movement, just as there was in 1 and 2. As I said before, in 2014, the law said that the department shall, by regulation, issue minimum qualifications. The October 2022 proposed regulations did not even mention independent facilitators. at least in the May regulations, they did establish minimum qualifications. There were comments on those. We'll see where they come out. Okay. Any questions on that? Take a minute to just, anybody's got a question or a chat?
You had mentioned, you had made a comment about, self-direction equivalent to the traditional services. I'm looking in the chat. There's one person who just shared that their office will not tell them the cost of traditional services. And there's another comment that their area office is basing the whole budget on the lowest service rate, not on the person's needs. Questioning if she can use Chapter 257 to argue that.
Well, from my perspective, now this is my own perspective, there's two aspects of this question. When you talk about a service rate, I don't know whether you're talking about a service rate in the traditional service system. I don't know. I don't know if you're talking about a community-based day support rate or whatever. But you have to kind of analyze, or you have to know what service rate you're talking about. But the person who has been in self-direction from 2020, and it's now 2024, their funding allocation, whatever was based on 2020, it would be a function of have their needs changed up or down, but needs change, and then whatever the needs are, they're connected to the traditional cost of services, which have, as I say, gone up 30 to 40% without considering this. So yes, the answer is a person can argue and suggest that the methodology that the department is using to determine their funding allocation is not correct. And unfortunately, they almost have to come up with the information that the department is not applying the increases to traditional cost of services that have been enacted under Chapter 257 over the last 4 years. So one of the things that we're going to be doing that goes at the very end of this is we're going to be doing systematic education in writing and writings, and also in recorded sessions and in webinars and in person and webinars. We're going to be getting into the nitty-gritty of this because it appears that may be what people have to do, is they have to formulate their own methodology for pressuring or forcing a department to provide an assessment of the traditional cost of services related to their individual's needs. Well, sorry for the long answer, but yes.
Can I add, can I add something, Robert, to that?
Sure.
Based not just on 257, but based on the waiver. And I'm assuming you're going to get enough funds. You or your family member may not be on the waiver yet. That's really important to get on the waiver. And for people that aren't, we're going to be doing a whole thing at the ARC around how do you advocate, to get more substantial funding so you are put on the waiver as a person or as your family member, because DDS says to the Center for Medicare and Medicaid, and remember this is important because they get money back from the federal government, that they are being fair in how they're assessing people. And we know all too often the elephant in the living room. This is one of the things, Robert sort of helped me to, get that elephant out of the living room and into the front of my screen. They're not doing that, okay? And they're actually breaking the waiver, okay? So we just had a new executive come here from Virginia and North Carolina, and he said to me, Leo, do you think they are complying with the federal community settings rule, which also includes person-centered planning? And, I said to him, I hadn't even thought of that yet because it's just getting implemented, in recently, right? So they're not, but even without that rule, and to Robert's point about the number 3, well, not just number 3, also that this self-direction should be also about what you can purchase. That's actually in the waiver too. That, and tell me if I'm wrong, Robert, my recollection is in the self-direction portion, they check off both boxes. So that technically what's going on with the department is there's 3 problems, not just with Chapter 257. One is that the assessment they use for you or your family member. 2 is the way they then apply the damn assessment to the funding level, okay, let alone Robert's point about cost of living and the increases, right, that traditional services get. And the 3rd problem is making sure you really get to have your person-centered plan implemented, whether you're getting a sports service, whether you're getting self-direction, or you're in a 24/7 program or a day program. So those are all the things. And again, we're going to get revved up on this, but we're just, I think, coming to terms with how much deeper we have to go. Another question was, is the change in leadership going to slow us down? A little bit, but I think our attitude is we don't want to let it slow it down. We're going to need you in this community. We should have a plan of action that re-energizes around the administrative piece and get the state agencies, whether it's Mass Health or DDS, to align better with progressive policy and actually what they say they're doing, okay? We're not even asking them to do something different. We're asking them to do what they say they're going to do. So if we can work together on that and we have enough people working with us, because this is really going to be like, it's really going to take people to do this, right? Because this is a culture. This has been behavior that's been going on for more than a decade. We see sometimes improvements and then we slip back, right? So, and I'm looking at Chris Hubbard, and I remember when she first got involved, that was a couple of years ago, Chris, but I remember her shock at some of the community residences, right? And I had to explain, no, nobody wants it like that, but it seemed like she was so shocked about some of the lack of training and, and this is what we've got. And obviously things got better a little, and then it got worse with COVID and this post-COVID period. So we've got to broaden access for people and the choices they have. And we can do that, we can do that together. Anyway, sorry, Robert, I just wanted to add that there's other things on our side.
Right. So I just want to kind of do a 40,000 feet overview of what Leo was saying. So you have a real lives law, which repeatedly speaks to both deciding what supports and services are needed and the right to purchase services. So you have at that broad level no restrictions on how a person funds their services, whether they hire somebody or whether they purchase services. And then at the other end of it, you have the home and community-based services waivers that DDS proposed to the government, to the federal government. The federal government agreed with them, where DDS basically checked almost all the boxes on both employer authority and budget authority. But the reality is DDS wants to limit this to an employee program. That's the reality of it, and that's reflected in the regs. But the good part of it is we've got federal agreements and we've got the real lives law. So and I'll tie that into the fact on the question that the individual had about, can they communicate with the area they're concerned about the way in which their budget funding allocation is being determined. That the MA21 is now, at least I think that the steering committee has agreed, we're going to go on a full bore education effort and training, trying to help people determine how they can actually be their own advocates and unfortunately have to argue for their own case. And that will be one of the subjects of how do you make sure you've got the right current needs, and that then it's translated to what the traditional cost of services would be for those needs. And then that translates to your funding allocation for the year. Not a static funding allocation, but a funding allocation based on both needs and based on increases in in what the traditional cost of services are costing.
Before we move on, this is a question regarding, and Karen, correct me if I'm wrong, regarding number 3 on the slide that we see.
Mm-hmm.
And the question is, well, not, it's a comment and a question. So Karen's worried about number 3, that's noted on the slide. She feels that they will lose a lot of money for the things that their child does if they implement this regulation as proposed. How can we change this at this late date?
So can I just add, so we have a decent budget, but right now we're using some of it to purchase things like the Berkeley Special Needs Music Program and other things like that, that enhance his life, that are part of his real life, that are an integral part of his real life program. And he has a person-centered plan, which includes that stuff. So what can we do to keep them from issuing these regulations? And then they issue them, and it doesn't really matter what the law says if the regulation, because the staff is going to have to go by the regulations. And then they will destroy my son's program. I mean, he's got a fantastic program that right now. And it's really expensive, that program. I can't really afford to pay for it myself. He needs this.
Yeah, well, let me jump in.
What
on
can we
that.
do, Leo? What, I mean,
Yeah.
I do
Well,
advocacy all the time.
Yeah,
What should
so
I be
here's,
doing?
no, this is really important to understand. First place, as Cindy said, you do have to do that. And Cindy, I have a new map thing to tell you about, which you may already know about, but I thought of you when it came across the transom with the chapters. But to your point, have they taken it away yet? Are you worried about the future? Is that what you're saying? Because right now is it because if it's happening right now, what I would strongly recommend.
No, not right
Okay,
now. Right now,
okay.
everything is great.
Okay,
But
well then
I'm
do,
worried that they're
right.
going to say, well, the new regs say this,
Right.
and I have
Well,
to follow those rules.
Well, some people are being told, though, sadly, that even right now, that they can't do that,
Yeah,
okay?
I know.
So what
I
I
know.
want, what I was gonna just encourage people to do is, without being arrogant, but being assertive and being clear, this is what's in my person, and you did the right things. It's in your PCP, and then that PCP is integrated into the ISP, right? Make sure those two things happen. If you get any pushback, you go, up the food chain and eventually to the ombudsperson, and you even tie us into it, Jackie Doherty and others, or someone else, one of the team at MA 21. There's several organizations that we're joined together with and collaborating. But hopefully it doesn't come to that. But if it does, but so that's what I would say for today. But we're working hard for that not to happen. And remember, they're telling the federal government that they're doing this, that they're doing both, okay? Despite us getting a hard time on the purchase of stuff, okay? As Robert said earlier, right? So, and those of you that do this stuff know that, especially those of you that specialize, right, in helping people. I see a few people on the call that focus in this area, and I'm sure you're hearing horror stories all the time and workarounds that people are doing. So that we will work together. That's why we want you, we're glad you're part of this, because we will be joining hands and figuring out, okay, what's the best plan now, in terms of getting with the administration, getting policy and behavior to align with progressive and the right things to do. Again, I don't want to keep repeating myself.
Well, I've already had a conversation with my state rep about this, but I'm more than happy to join any group and talk to administration people about this, because it's really panicking me. Like, we are lucky. We have a good program. We have a good life for our son who is happy and well-adjusted, and they're going to take it away by this stupid, it's like such a narrow-minded way of looking at self-direction. And it's not going to help the future administrators either when they want to make more creative ideas happen. They're not going to be allowed to do that if these regs go into place the way they are right now. That's the other thing. The future is
Yeah.
very threatened
So
by
we will be
that
sharing. So
problem.
let's hold off now. Let me let Robert continue, but we'll be doing that. And there's a couple of people who are experiencing problems now, and hopefully you got the right feedback from us, and you'll loop some of us back in as you need to,
Yeah.
people that are not getting. So
Sure.
I'm thrilled that you were able to get it done. And as Cindy said, enforcement's always the issue. And Robert, you want to go back? I'll put up the screen again.
Well, I only want to say that the you know, whether the person speaking worries with respect to their particular situation are valid or not in terms of the regs affecting it, I don't know. I mean, it could, but one of the things that was not changed at all from October to regs to this were this cockamamie. I call it cockamamie, and I'm glad to be on the recording. They call it staffing and non-staffing, and that's how they divide. They don't define in the regulation staffing, and they don't define non-staffing. I think I know what it means probably, but it's subject obviously to the new interpretation, because those are not traditional terms used in any of the system. And I think I know what they mean, but and there was no movement on that. So one thing is if anybody is interested in that, as soon as these regs drop, then there's going to be an absolute requirement. The department's going to have to figure out what the heck they meant by staffing and non-staffing. They have to define it. And
Yep.
There's a little bit of a key to it in the participant direct toolkit, I think, of what they mean.
So
by
Robert, I'm going to ask you
what
to
I'm
hold.
saying, I'm saying is this person or anyone on this call wants to participate in that issue, in that particular issue of how they implement that part of the regs, please let us know.
Yeah,
Okay?
and we're going to hold off on more questions till Robert finishes this piece of the presentation. And I don't think we got that many more slides and part of it can be problem solving as well, you know, for people that are experiencing issues.
Okay.
All right, go ahead, Robert.
So I was more going at the general, and I welcome people breaking it up. If they have more they want to talk about, I welcome, but I don't think we can address individual things, but we can address how people might help us. Okay, the next slide is, I see you're getting, it's 2:16 and we've got till 3 o'clock. So all right, so this is another example of we're going to the Self-Determination Advisory Board meeting if you can make it. And they've not made it good on virtual. So it's a very small room. It's also a lousy place to be outside the table that people are sitting at. But anyway, the support intensity scale, the department in 2022, early 2023, made a determination that the mass cap and any other assessment tools that are being used were not adequate to determine individuals with disabilities, developmental disabilities, intellectual disabilities, to determine their needs and then their level of services. So they just decided the tools they were using were not adequate, and without any, as far as I know, any consumer stakeholder input, they issued and then entered a contract with the American Association of Intellectual and Developmental Disabilities to develop a program to institute over a number of years to institute the support intensity scale adult version, second edition, which is the AAIDD's support scale that's used in other I think 20 different states, and they decided to start it out on July 1st of 2023 with 500 assessments. These were kind of pilot test assessments. All 500 assessments were going to be done on persons with self-direction, who were in self-direction. And they were to have 500 of them done by June 30th of 2024. The reason they needed 500 was because That was the number they needed from a demographic and levels of impairments and so on, develop a statistical data system that would then result in a valid framework for deciding what the level of services would be based on the levels of needs. So so they're at as of September 4th, the SDAB meeting, Self-Determination Advisory Board meeting, they were at 230, and they got to get to 500 at least based on AID. That's what they need to have a valid statistical basis. And again, this is an earthquake in Massachusetts if they can possibly implement it, because it would apply to all 30,000 or whatever number are in the entire system. It's not just for self-direction at all. It's critical to self-direction though, because the funding allocation for self-direction is based on two things, again, based on a needs assessment, current needs, and based on traditional cost of services. Again, people to keep up, I wouldn't have recommended these SDAB meetings 2 years ago, but I would today. The department, since they entered this contract, they have appointed a director or hired a director of clinical assessment. She made, as far as I know, her first presentation at the SDAB meeting in September. They've now hired a public relations firm to help them with families, to get the families to agree to the SIS, because they're at 230 because they've had a difficult time getting families to agree to do kind of a test assessment in what is, I think, considered to be, if not grueling, time consuming. And so they're building a toolbox to make sure that they get good information out to families, both internally within their department and externally. They've hired additional staff to do the assessments, and it was always planned that AID was going to do the first 300 or so of the assessments, and then DDS staff were going to start to train staff were going to start to do it. But I think they're trying to move forward on getting those trainings done so that internally they can do the assessments. And so that's kind of just an update on that. It's going to be if in fact the DDS continues with this. I mean, I have my doubts myself, but if they do, it's going to have a significant impact on self-direction and on the entire system. Leo, you want to add anything?
No, I think you pretty much covered it. I was going to say, I think, yeah. And I guess we just don't know how well they're doing with self-advocates in terms of really people would dispose themselves. There was a question asked at the meeting about, what percentage, how do they try to cajole and adapt, right, for good interviews with them. And I think it's open what that means, how well they did that or not. And then Sandy Heller said she went through it or know someone that went through it, and it was 4 hours. So that's probably why they hired more staff, that they had assumed it'd be shorter. And they're realizing it's pretty, it's an involved process. It does have, it's used nationally. There is the issue, though. HSRI has been hired, as we've shared before in the past, to then take these results and turn it into dollars, what's the costs are. And this is somewhere we'll have to be very involved, right, to make sure that the valuing of the results reflects, it's done in a fair way. That's not just an automatic algorithm. So you always have to worry about that. So I'll leave it at that.
Okay. Diane, did you want to add anything, or is there anybody that's got their hand raised? Okay.
Not on that, no.
All right. So the next thing, so again, kind of just bringing you up to date on that. The next thing on independent facilitator is that as I said, that October 2022 had nothing in them. The proposed regs do. We're not waiting for the proposed regs to get ourselves moving on this particular issue, because we're going to assume they're going to be in there, good or bad. They're going to be in there. I mean, there's going to be a level, and also the department itself. Again, if you were at the SDAB meeting, the department itself is through its own internally and with a subcommittee of the Self-Determination Advisory Board, and also outside members. They're working on training for independent facilitators, and they're working on job responsibilities for independent facilitators. So they're moving ahead as if the regs had been enacted. The definition here, then we just, it's what the real lives law says is the definition. What MA 21 is doing is we're looking at one of the things the law requires is that once you get the qualifications, then the department's got to maintain a list of people that are qualified to be independent facilitators. They actually have a list so that people can go and say a participant or whatever would like to retain that person. And MA 21 is looking across the country at what training programs are going on, both training programs offered either by the government or, for instance, in Michigan, we're looking at particularly, they have contracted with Wayne State University to do the training for independent facilitators. And then if you look at other states like California, there's a very sophisticated independent facilitator training academy that is independent of the government and provides training. So we're looking at both models, but we're certainly getting prepared for MA 21 and other outside groups to put together independent facilitator training and not relying on what DDS might or might not provide as training. And even if it's not, doesn't have to be sanctioned by DDS. I mean, it's just, it's another thing you put on your resume or your independent facilitator experience. I did go through this rather, substantial independent assessment. And there's plenty of models for that. The National Academy of Social Workers, lots of places have training sessions that then you get some type of a training certificate or whatever that you completed it. So we're putting together that as we speak, so that we're ready to go when it's finally out there that their minimum qualifications are set and that this list then is going to be developed. Questions? Okay. You want to pick that up now on the last topic, or you want to just go on and we'll catch it up the next one? Diane?
I'm sorry, Robert, say
Oh,
again.
there was somebody in the chat. That's fine. We'll pick it up.
Let's keep going and then pick up the dialogue at the end.
All right, we'll pick it up because we're getting close to the end. Okay. So again, this is a little bit MA 21 future priorities. The independent facilitator one that I just spoke of is certainly an ongoing priority, and we're doing it now. In terms of future priorities, the preface of this document should be that in collaboration and consultation with I'm reading this, with MA 21 member organizations, MA 21 will prepare education, personal advocacy materials. That means, to me, personal advocacy means, how do you make sure you get a fair funding allocation under the present circumstances, not what it ought to be, but how do you get for your child? We're going to prepare materials, recorded presentations, and seminars for individuals with disabilities and their team members interested in self-determination or in self-determination. And the materials and the recorded sessions and so on are going to go through and look at the foundation. Everyone who is in self-direction is also in the system of how services are determined. You start with eligibility. You're still in prioritization, even if you're in self-direction. You're in the needs assessment situation. We talked about supports intensity. You're in the individual support plan process, you're in the person-centered plan, you're in the plan of care. So the first three are all, and you can appeal under those systems. And then you finally get down to the very last, and you're into particular processes regarding self-determination, which include could include eligibility for self-direction, funding allocations, service choices, retaining an independent facilitator, and your appeal rights. One of the things in the regulations is that was required by the law was they put in specific appeal rights. Well, we still don't have regulations, but the proposed regs do have appeal rights in them. So in what we've done so far on that is we have done a survey as the best we can and still developing, but we've looked at all the materials that are out there now that really deal with personal individual advocacy. And probably the best set of those is they're just written, but they're on the Disability Law Center. So anybody interested in this part of the education process, personal advocacy, I would urge you to go and look under the Department of Developmental Disability Services section of the Disability Law Center as to the resources they have. And they have five very good, or they have 5 or 6 very good 2 or 3 page on eligibility, prioritization, needs assessment, appeal rights, the first 4, and they also have a very good section on community rule that Leo's been referring to. Just put that up a couple of months ago. So I'd urge you to go read that because those are the best materials I've seen. And then we've also, certainly taken into account the DDS situation. I mean, in materials, participant-directed program toolbox. They have a individual support plan policy and procedure manual of 2012. That's pretty old, but they also have the participant-directed toolkit, which is more recent. And they also have a agency with choice manual that's intended for field staff and AWC providers that is informative. So we're looking at those materials out there, and we're going to move ahead then on having regular, systematic over the next year, 2 years, systematic programs so that people can go to written materials, recorded sessions, and live sessions to get into the nitty-gritty of how to make sure that the system is working for your child, or the system is working for the adult with disabilities.